How do rhegmatogenous, tractional, and exudative detachments differ? Imagine your retina as a delicate wallpaper lining the back of that keeps your vision clear. Sometimes, this wallpaper can peel away in different ways, leading to what we call retinal detachment. There are three main types: rhegmatogenous, tractional, and exudative. Each has its own cause, process, and appearance, so understanding these differences can help you grasp how they affect vision and treatment options. Rhegmatogenous retinal detachment is the most common type. It happens when a full-thickness tear or hole forms in the retina, often due to aging, injury, or conditions like myopia. This tear allows fluid from inside the eye, called vitreous humor, to seep underneath the retina. As the vitreous shrinks with age or trauma, it pulls on the retina, creating a break. Once the fluid enters through this break, it lifts the retina away from the underlying tissue, causing detachment. If you imagine a wrinkled or corrugated sheet that moves with movements, that's how a rhegmatogenous detachment often looks. It can develop quickly or slowly, depending on the size and location of the tear. Treatment usually involves surgery to seal the tear and reattach the retina, preventing permanent vision loss. Tractional retinal detachment occurs without any tears or holes. Instead, it results from scar tissue or membranes that form on the surface of the retina or inside the eye. These membranes contract over time, pulling the retina away from the underlying layer. Think of it as a tug-of-war where scar tissue pulls the retina in one direction. This type is often linked to diabetic retinopathy, a complication of diabetes that causes abnormal blood vessels and scar formation. The detached retina in tractional detachment tends to have a smooth, curved shape and doesn't shift much with eye movement. Because of the scarring and pulling, surgery to remove the membranes and reattach the retina is usually needed. Exudative or serous retinal detachment is quite different. It occurs without any tears or traction. Instead, fluid leaks from abnormal blood vessels or inflamed tissues underneath the retina. Conditions like age-related macular degeneration, tumors, or inflammation can cause this leakage. The fluid buildup pushes the retina away from the RPE, the layer that nourishes the retina. The retina appears smooth and may shift position when you change your head's position, like tilting your head. Since this type results from fluid accumulation rather than structural breaks or pulling, the main approach is to treat the underlying cause, controlling inflammation, managing tumors, or addressing vascular issues. Surgery is less common unless the underlying problem requires it. To sum up, rhegmatogenous detachment involves a tear letting fluid in, tractional detachment is caused by scar tissue pulling the retina, and exudative detachment results from fluid leaking underneath without any tears or traction. Each type needs a different approach for treatment, and early diagnosis is key to preserving your vision. If you notice sudden flashes of light, floaters, or a shadow or curtain over your vision, see an eye specialist promptly. Remember, only a healthcare professional can determine the exact cause and recommend the best treatment plan for your eye health.